health workers, we serve as witnesses to our ancestors' wisdom, carry buckets of compassion on this bridge we call our backs, as we transport the antidote to anxiety in our smiles. We restore faith with just a touch on weary shoulders, like a vaccine that cures fears and self-doubt. We inject hope into families by offering consistent company. We wear their worry on our fine lines and stand with them in their personal battle lines as they fight their way back toward optimal health. And not just the absence of disease, but an embrace of evidence of their reclaimed empowerment. Like a young peacock who finally realizes it can't fly, but can still strut, knowing it has the most gloriously beautiful wings of any bird. We are heroes. Community health workers, we value the lived experiences and accumulated knowledge of our people because they have endured time in the evaded craters of life and have brought back to us diamonds as precious wisdom. Though sick, we remind them that we are culturally strong. We help them share their stories and sing their songs because we have read their same books and recited their same poems and heard their same drum beats whispering in our ear before we were even born. We have trod those same stony roads that they have seen, tasted the same spice and tender hand pops in our collard greens. And when you ask, who taught you how to weave your culture so handsomely with mismatched and lopsided scraps of fabric, faith, and folklore? And when she responds, Mama and them, we know exactly what she means. Because as community health workers, we embody the principle of Ubuntu, I am, because we are. Our mission is not based on charity, but solidarity. Because as members of the same oppressive society, what affects one affects us all. We are family. As community health workers, we observe and ask, remember, and listen, so that we can teach ourselves to tell the difference between belligerence and hunger, mild dejection and deep depression. We advance in awareness of the dichotomy between justice and just us, and recognize that poor health is more complicated than just, she's too lazy to exercise. He needs to lay off the fried foods. Too much candy gonna give you sugar. And she should have known better than to get involved with that gang member. See, we connect our people with the right resources for housing, food, transportation, childcare, healthcare, self-care, which all play a part in successfully raising health indicators and lowering blood glucose levels and increasing knowledge of condoms and exercise and healthy food. We use relationships to decrease the risky behaviors for mama and them and her whole group. We use soul medicine to redefine what is possible. We are educators. As community health workers, we improve healthy outcomes, raise family incomes, influence public policy, and help us to believe in we connect with, we campaign for, attend to, and then repeat, shape up, shut up, and come in and sit down, go out to teach. Evoke emotion, empower minds, motivate action, transform lives, reclaim dignity, evoke empathy, treat with dignity, get down to the nitty-gritty. You hit that child like that one more time, I'm showing up, coach. As community health workers, we build the capacity of our community to solve its own difficulties while recognizing the systematic stressors of racism, homophobia, poverty, and how those factors contribute to chronic challenges like obesity and HIV, diabetes, substance abuse, lupus, and even heart disease, domestic violence, gang violence, and even every other socioeconomic travesty. We do our jobs authentically from a shared cultural base, specifically. Because this group of queens and kings here, we are multifaceted.
Revolutionary.